Hey everyone, I'm Hari Krishnan Venkatesh. I'm from Team 76. My teammates are Varun Subramaniam and Ritvik Krishnamurthy. Our project is RSNA 2022 Cervical Spine Fracture Detection, which was taken from Kaggle. So, to basically give an overview of what our project does, we try to work to find out if there are any kind of fractures in the cervical area of the spine. So, this top part that you see, which is brown in color of the spine picture on the left side, that's what the cervical part is. So from C1 to C7, this area is the cervical part of the spine. We focus on this part and we try to use the images that we were given by RSNA for the purpose of detecting spinal fractures there. So the data that we're given were DICOM images, which is on the right side, which you can see as CT scan images basically of a specific patient. So since it takes images, when you take a CT scan image, it takes slices from the top to bottom. We have each slice here. So a patient could have multiple slices based on how big their scan is and how much detail they want to capture in that particular scan. And this is the data that we work with. We have data with uh, a data of multiple patients, and that's what we work with. And what our objective is to basically be able to detect any kind of fracture, because cervical fractures are actually pretty dangerous, and sometimes they go undetected because of how small they are, and that could cause like a lot of issues, because of which this was something that we felt would be a right topic, which would give us an idea about how to work with medical images, as well as would help us find a robust model which would help us solve our problems. To look at our data set, as I mentioned before, is just multiple CT scans of many patients, and each patient could have like a different number of CT scans. It's not necessary that all of them should have the same number of scans, or I mean slices per patient. So when we look at the left graph here, we can see that the number of patients who don't have a fracture are about 1058, and we also see the number of patients who have a fracture are 961. So we get to know that we have a pretty close distribution of the patients who don't have a fracture as well as patients who have a fracture. Now, when we come to uh, the right figure, we see that the distribution amongst the different vertebrae from 0 to 7, uh, they are pretty similar. They're not very skewed. So this shows us that our training data is pretty balanced. It's not unbiased towards any specific vertebrae section, and this makes it easier to know that our results can be pretty accurate and not really flawed, because if we had something like C2 had only about 500, while C7 had about 20,000, we would know that it would not be able to accurately predict the results if a C3 section is given. So, which is why now we know that we have a pretty balanced data set, and this is what we're working with. So, to talk about our methodology, what we'd initially used is the ResNet 18. We knew that it just captures the deep level information of features of an image. And what we wanted to do was something even more vast this time, which was to find the EfficientNet V2 model, which a pre-trained model, which basically tries to capture both the depth and the width convolutions. And this seemed like a pretty important thing, because the more detail that we capture, the more better, because that'll help us to detect the um, the data, or to predict the fracture in case it exists in a much better way. And to just give an overview of how this works, we have a few slices of data that we pass to the EfficientNet encoder, and it flattens it and gives us two results. And these are the two main parts that we should focus on right now, which is the word part and the frac part. What the word part basically does is it helps to classify which vertebrae these slices belong to. So how it does that is we were given segmentation masks for each vertebrae, and we used that to train the model to detect which slice belongs to which vertebrae section. So this could belong to C2, which we wouldn't know if the encoder wasn't trained with the segmentation masks. So now we give the segmentation mask to the encoder, and now it'll know that once this is fed to it, it'll know that it'll be a part of C2 for now. And the fracture part, or the frac part, basically detects whether there is a fracture or not. And what we've done is we've used weighted loss here. And how it works is that we have we kind of give a higher weightage to fractures and lower weightage uh, to non-fractures, and which could also be reversed to see how it plays out. And what we do is at the end we just use this data, and then we get the final loss, and we also we can easily predict using this. And to show our results, what we have here is we for us it doesn't make sense to show some kind of frac it doesn't make sense to show some kind of accuracy, because in our case it's not like a one hot classification where you're trying to predict between four classes and just one of it is true. In our case, you could have multiple things to be true. So we could have all the seven, so the vertebrae to be fractured, or you could just have one to be fractured, or just two to be fractured, or none of them to be fractured. So to have something like an accuracy here wouldn't make sense, especially because of the fact that we have a weighted loss, and which is why right now our best metric is to see the frac loss and the vert loss, which is basically the loss for the vertebrae section that I showed you before, as well as the fracture section. So and we basically combine those, and then we give you the best the loss based on that. So you can see that here. So we have the frac loss here, we have the vert loss here, and then we have the combined loss here. And what you can see here, even though it's a little blurry, you can see a lot of scattered colored lines, and that's for the previous model. And this little bit consistent line with respect to the brown part, that is for the efficient vnet that we have. And we thought that the fluctuations were much lesser in this case, and this was better, and this was the reason why we were able to finalize this as our model. And now when we look at the same thing for the word loss, we see that that's exactly how it is. This is how it was for the training part, and now when we try evaluating it for the uh, testing part, we still see that it's pretty close to each other. But relatively, what we did was we found out that efficient vnet performed a little better than resnet, and that is the reason why we decided to choose it. But our learning does go this way, that the models aren't extremely different, or they don't do extremely better when compared to each other, but they it does do a little better. And I would say that's a pretty big learning that we got from this experiment. We understood that just because like a model is really overhyped in the market or something, that doesn't mean it's going to work extraordinarily well for your use case. And that's what I learned from this, and that's what we learned from this, in fact. And this has been our presentation so far, and uh, these are our details. I'm Hari Krishnan Venkatesh. My teammates are Ritvik Krishnamurthy and Varun Subramaniam. Thank you.